The main purpose of this research study is to evaluate a new approach to treat bladder dysfunction. After spinal cord injury, one of the things that happens is you lose bladder control. Here at the Cleveland VA, we've had a very long history of strong ties between the clinical service in spinal cord injury and research and preclinical work.
We've been able to do a lot of work with veterans as study participants. They're also acting as members of our research team, giving us critical feedback on what we should be focusing on with our research.
The main purpose of this work is to send people home with a very simple device so they can use it to improve their quality of life, reduce urgency, reduce incontinence. One of our strong preferences is to work with the natural nervous system. We take advantage of the natural nervous circuits that are in your spinal cord that still exist after spinal cord injury. It's just that the brain signals can't access them. So we try to find sensory pathways that can interface with those circuits and influence them.
I can apply mild electrical stimulation either outside the body with electrodes on the skin or with an implanted system that will cause muscles to contract or relax.
There's two leads that connect to a little gel pad that you stick to the base of your penis. It just sticks there, and then the leads connect to the little controller. It's a little bit larger than a wallet. You click that on your belt, and that's the extent of it. It's easier than a spinal stimulator to use.
One of the key components to our study is the sensory stimulation. We have non-invasive surface stimulation approaches that can be used to diagnose subjects. They can be used for them to try out the technology before they have an implanted system. One of the benefits of being in the center is the ability to share information and technology, both at the preclinical and clinical levels. Being able to share the underlying rationale behind your studies. We can borrow technology from the lower extremity group. We can borrow their wireless technology. We can steal the long-standing stimulator technology. And within a couple of years, we can have a new bladder device. It would normally take millions of dollars and years of development. But through collaborating in the center and the collaborative environment we have a device in a few years that we're already sending people home.
It's very easy to participate. The most time you spend is basically measuring how much fluid you take in and how much you expel. If you don't want to be restricted to being next to a bathroom or wearing a catheter, it's great.
This technology applies not just to spinal cord injury, but there are large demographics of veterans and other populations that have bladder dysfunction.